Hi, welcome to our neurometabolic video series. Again, my name is Dr. Sean Price. I'm the clinical director here at Chiro Spa in Fort Walton Beach, Florida. Today's video is going to be regarding the different patterns that thyroid dysfunction can happen or can have. Now, keep in mind, we are discussing why you may be having normal lab values and why you may even be on medications and why you still don't feel well. We're also discussing, if you haven't been to a doctor yet, why you may be having symptoms of thyroid issues, symptoms of brain fog, inability to lose weight, intolerance to cold, excessive weight gain, fatigue, all kinds of different functions. And actually people that have hyperthyroid can have symptoms such as heart palpitations, anxiety, different things like that. So we're here basically to help you understand what might be going on with you and why these symptoms might be still going on if you have sought treatment and not gotten the results you're looking for. Now keep in mind, my goal is not to take you off of your medications. It's not even to advise you on your medications. That is not what I do. Any medication discussions that you have, it needs to happen with your primary care physicians. I'm not even here to diagnose your condition. I'm here to explain to you how the body functions and what kind of malfunctions can be happening and what you can do about it. There are natural things that you can do that can actually support the natural function of the body and in turn help the body actually heal itself. So that's what our goal is here. So let's move forward. I'm going to review real quickly about thyroid metabolism. If you need a more in-depth explanation of the thyroid metabolism, please watch the previous video on thyroid metabolism. Okay, so the hypothalamus gland is in the brain, and that the hypothalamus is a part of the brain that helps to control thyroid function. The hypothalamus gland releases a hormone called thyroid releasing hormone to the pituitary gland. The pituitary gland then tells the thyroid what to do, and it does that by communicating using a hormone called thyroid stimulating hormone, or TSH. And this right here is the key that is measured in most lab tests that most doctors do. Now I want to discuss very, very briefly what a normal lab test is. When you go to the lab and your blood is drawn and they send it off to the lab technicians and they analyze the numbers and everything, they come back with a numeric value or a number, and they determine whether that number is normal or not. And in the medical model, anything within normal is considered okay. Anything outside of normal is considered not okay. Makes sense. The discussion is, what is a normal value and how is that determined? Well, what happens is they take an average of all of the patients that come into the labs. All of these patients come in there, whether they're very, very, very healthy people or very, very sick people. And they take all of these labs and they take all of these numbers and they put them into an equation and they create a bell curve. So it kind of goes like this and then comes up like this and it goes down like this. And then they determine that as long as you fit in that bell curve at certain levels, then your lab values for that certain lab are considered normal. Now keep in mind, these lab values include healthy people, which how many healthy people really go and get lab work done? And not a whole lot. And it includes unhealthy people. How many unhealthy people go getting lab work done? Well, quite a few. If you're sick, that's one of the first steps that's taken to try to figure out what's going on. So this is a very wide range of what they consider normal, and it will encompass a lot of maybe not so healthy people in that normal range. So what will happen is, as long as you're within that normal, for example, with thyroid stimulating hormone, depending on the labs, a normal can be anywhere from 0.5 up to 3.5. They might consider that normal, depending on the lab. Functionally, what we do with functional nutrition is we look at a functional normal. And functional normal means basically that you have optimal function. So when you're looking at thyroid stimulating hormone, for example, where they might say 0.5 to 3.5 is normal, we might say 1.8 to 3.0 or 3.2 is more normal, because that's more optimal functioning. So if you fall out of that optimal functioning level, then we want to go ahead and start addressing that now, but before it becomes a disease process. Okay, so I hope that makes sense. So, but anyway, so when you go to the doctor, they're going to run a thyroid panel, and typically what they're going to run is this TSH. They might throw a couple more in there, but typically their treatment plan is based on what this TSH is doing. Okay. The TSH stimulates the thyroid gland, and the thyroid gland then releases T4, 93% of what the thyroid gland produces is T4, which is the inactive thyroid hormone, and 3% is or 7% is T3, which is the active thyroid hormone. This T3 is then gone off and used by the body. This T4 then gets on these little taxi cabs called thyroid binding globulins, gets in these taxi cabs. The taxi cabs drive this T4 around. The T4 goes to 60% of this T4 goes to the liver, where it is converted into T3. 20% goes to the gastrointestinal tract or your digestive tract, which is then converted into T3, and then the remaining 20% go to the different peripheral tissues in the body, such as the muscle, for that conversion. Okay, so that's the basic process. So what are the patterns that the dysfunction patterns that you can have that could cause you to still be having symptoms, or even be having these symptoms, period? Okay, well, the first thing is what we call primary hypothyroidism. That's our first pattern, primary hypothyroidism. In this pattern, you're typically going to see elevated TSH. Now, what this means basically is that the thyroid gland is just tired, or it's just not functioning right, and it's not able to push enough T4 out. Okay, the hypothalamus gland is getting its message out perfectly. The pituitary gland is doing its job. It's releasing that TSH to the thyroid gland. The thyroid gland just cannot push out enough T4. So when the T4 comes out and that level is low, well, the hypothalamus gland senses that T4 being low, so it tells the pituitary gland, hey man, we need more T4, so it keeps on producing more and more T4, so that TSH is elevated. So what happens with this, the way that you can know if you're primary hypothyroid is if you go to the doctor and they put you on Armour or levothyroxine or Synthroid, and you notice a drastic difference, you feel great, your body's functioning so much better, that's primary hypothyroid. Okay, that's the one condition that the thyroid hormone medications alone will really significantly give you good results. And you'll know, probably if you're primary hypothyroid, you're not watching these videos because you probably feel a lot better. There are still things that can be done to try to support the thyroid gland and get it to where it's functioning again. So maybe you can lower those dosages or whatever. Again, I don't discuss that with you. There are still things to be done to support that, but that is what primary hypothyroidism is. And again, that will symptomatically be significantly helped by thyroid hormone supplementation through medication. Okay, so that's the first pattern. Our second pattern is what we call secondary hypothyroidism. In other words, the thyroid is under functioning again, but it's secondary to a primary pituitary dysfunction. So remember, the pituitary gland sends the thyroid stimulating hormone to the thyroid. If that pituitary is fatigued, overtaxed, and unable to work right, has something going on with it, and it's not producing enough TSH, then the thyroid isn't going to produce enough T4. Okay? So again, in this pattern, your TSH will tend to be low. Now, supplementing with T4 may or may not help that TSH level. It's really hard to tell, but you've got to figure out what's going on with that pituitary gland and why it's not sending that message out properly. And this can be challenged by excessive stress, because the pituitary gland also supplies the hormones to the adrenal glands. It can be affected by poor dietary choices. For example, the standard American diet being high sugar, high carbohydrate, high processed food can really stress out all of these factors, all of the hormonal factors involved. So we need to figure out what's going on and why that pituitary gland is not doing its job properly. Make sense? Okay. The third pattern is what we call thyroid underconversion. Now, in this pattern, everything seems to be functioning normal. You've got the pituitary gland sending enough TSH to the thyroid gland. In fact, in this pattern, your thyroid TSH levels can be normal. Thyroid gland is producing enough T4, it's producing enough T3, so the hypothalamus is happy. So everything from this point up is functioning like it should. But there's an underconversion, which means that for some reason, this T4 is not getting converted to T3 properly out here. So we have to examine and find out what's going on. Excuse me. We have to figure out what is going on and why that conversion is not happening at the right rate. Is it an issue in the liver? Is the liver toxic? Is it not able to convert T4 to T3 like it should? Is there inflammation in the GI tract? Is there leaky gut syndrome? You know, what's going on in the gastrointestinal tract? What's going on in the body that's causing the body not to be able to convert these hormones like they should? How do we figure this out? Through testing, through lab testing, through blood work, through urine work, through pH testing. There's a lot of testing that we do here in this office that is not typically done in the medical community, because we explore things that don't fit into the medical model. We explore overall body function, and you've got to figure out what's going on with the whole body. You've got to support the whole body and allow the whole body to heal, and when the whole body heals, that starts allowing all these symptoms to heal. Okay, I hope that makes sense. All right, so thyroid underconversion. Again, critical factor here. Doctor, why do I feel so poorly but my lab tests are normal? Well, because you have thyroid underconversion and your TSH is still normal. Okay. Number 4, thyroid overconversion. Okay. Everything is happening properly up here. Your TSH level, again, is normal. T4 and T3 are being produced properly. But for some reason, after it leaves here, your body is overproducing T3. It's moving your system into what's called a hyperthyroid state, which can be just as dangerous. So your body has protective mechanisms. If there's too much of something, the body backs off and tries to not allow these things to get into the system to cause damage. So if you have thyroid overconversion, then your body's going to not, it's not going to use as much T3 as it should. It's going to have a rebound effect and not use as much T3 as it should, so you're still going to have the symptoms because you're not using those hormones properly. Okay? Thyroid binding globulin elevation. Remember that TBG is the taxicab that picks up this T4 and carries it out to these tissues. So let's say, for example, let's use the example of we're at a bus station, okay, and we're all trying to go to, we'll say we're all trying to go to the Superdome for a football game. So you have 50 people standing at this bus station, and you have 25 taxi cabs to pick you up and take you to the Superdome. Well, that taxi cab's going to pull in. They want to make as much money as possible. They want to do their job. So they're going to pull in, they're going to pick you up, they're going to take you to the Superdome, and they're going to drop you off as quickly as they can, and then they're going to get back over here and pick up the next person. And they're going to race to try to see how many people they can get to that Superdome, because they make more money getting people to the Superdome. Well, in that example, you standing at the bus station are T4. The taxi cab is the TPG, and the Superdome is the peripheral tissue. So these taxi cabs pick up that T4, take it to the peripheral tissue, drop it off, and they get back over there as quick as they can. Okay. Well, let's say that you have 50 people at the bus station, but you have 200 taxi cabs vying for that business. Well, how are they going to make more money? Well, they need to get you into their taxi cab, and they need to hang on to you, and they need to take the long route to get to the Superdome, because the longer you're in the car with them, the more money they're going to make. So they're going to keep you in that taxi cab, and they're going to just drive you around as much as they can. Well, that's the same thing here. If there is too much of this TBG elevation, that stuff doesn't want to let go of that T3, because then it can't do its job, so it holds on to it. So then when it gets out to the peripheral tissue, that T4 never gets out of the taxi cab to be converted, so you have underconversion. Okay? And then the last one, and unfortunately the most common pattern that we see in hypothyroidism, is autoimmune thyroid. This can be called Hashimoto's thyroiditis. And what happens with this is the basic metabolism pattern is that the body, the gastrointestinal tract will become inflamed, and I'll go into this in more detail in another video series, but the GI tract will become inflamed and develop what's called leaky gut syndrome. When leaky gut syndrome occurs, it allows particles to leak into the system that should not be there, so the body recognizes those particles as foreign and creates antibodies. Well, some of these particles that go into the blood can be similar to thyroid tissue. So when the body makes these antibodies against this foreign particle, then when these antibodies are done beating up that foreign particle and getting it out, they go and they search the body for more, and they see the thyroid gland, and they start attacking the thyroid gland. And as that thyroid gland becomes more and more damaged, it has less ability to produce what it should be producing, and therefore you develop symptoms of hypothyroidism. How do you know if that's going on? Again, through the proper testing. You cannot just test TSH to see what's going on here. You have to do the proper testing to figure out what's going on. And that's what we do here in our office. Through our functional nutrition program, we do all the testing necessary, we figure out what's going on, and then we help you through a customized program to restore the function to the body. Again, we do not mess with medications, but we help you to restore function to your body. Now, I'd like to remind you that health is defined as not merely the absence of a disease or an infirmity, but also defined as the optimal functioning of the body, physically, mentally, and socially. And that's our goal, is to help you restore your health. You cannot restore your health one day, 1 week, or 1 month at a time. You especially cannot restore your health by one miracle pill, one miracle exercise program, or one fad diet at a time. You can, however, restore your health and actually reinvent your life by following a customized program that teaches you how to make the right choices, and then making those right choices one decision at a time. My name is Dr. Sean Price. Have a great day.